Hey y'all, it's Cheyenne Daniels, race and politics reporter for The Hill, and this is The Switch Up. In our last two episodes, we talked about the maternal mortality crisis, how it disproportionately affects Black and Brown Americans, the struggle of incarcerated pregnant people, and the activists and political leaders who are trying to end this crisis. Today, we're delving into this crisis just a little bit more and the decade-long fight to pass the Pregnant Workers Fairness Act. The PWFA is the first federal workplace protections for pregnant people enacted in 45 years. The PWFA's new regulations are set to be released any day now, and these new regulations protect pregnant workers' right to take time off for medical treatment, recovery from childbirth, and even the right to travel to obtain abortion care. In this special episode of The Switch Up, I sat down with Gillian Thomas, senior staff attorney with the ACLU Women's Rights Project, to talk about these new regulations and how they can help end the maternal mortality crisis. Take a listen. Pregnancy and pregnant people's rights right now are such a huge topic that we're seeing take place, not just in Washington, but across the country. And so I just wanted to start off a little bit with a little bit of context around where this act came from, and why right now it seems like there's this push for some of these changes.
For sure. And it's such a pleasure to be able to talk about some good news actually coming out of Washington, and to have it be in the area of reproductive justice to boot, for sure. So the Pregnant Workers Fairness Act is actually the result of no less than a decade of advocacy by the ACLU, by many partners, and it is a critical advance in filling gaps in existing law. So a lot of people are aware of the Pregnancy Discrimination Act, which has been in place for 45 years, and that protects people from discrimination because they're pregnant. Efforts to secure accommodations, and we can define more what that means, but efforts by pregnant people to get the temporary modifications they needed to do their jobs safely was only inconsistently getting covered under the PDA. The PDA only protected pregnant workers to the same extent that other workers in the workplace also received accommodations. So if the employer had some sort of a comprehensive scheme, like you were injured on the job, for instance, you could temporarily get a desk job, then the law was generally that had to be extended to pregnant workers too. That's what the PDA said. But that was inconsistent. A lot of employers were sort of slicing and dicing the definition of who was similar to a pregnant person for purposes of triggering that obligation to also accommodate pregnancy, and courts were often agreeing. And a lot of people know the Supreme Court decision from a few years back, the Young versus United Parcel Service decision. I think a lot of people thought that was going to resolve the issue. We as advocates certainly did hope that would resolve the issue, and it really didn't. There was a study done by one of our partner organizations, A Better Balance, studying in the years after Young that 2/3 of people who challenged denials of needed accommodations during pregnancy were not getting them. Courts were ruling against them. So that was the PDA. Then a lot of people know about the Americans with Disabilities Act, but it's very well settled in the law. And the ADA requires reasonable accommodations, and it doesn't have this comparison problem that the PDA has that I mentioned. The problem is that an uncomplicated pregnancy and just normal pregnancy symptoms like morning sickness or fatigue, or just prenatal visits that aren't caused by any sort of disabling condition, that wouldn't qualify for accommodation under the ADA. And then the last example I'll give of how law was failing us on the federal level is the Family and Medical Leave Act, or FMLA, which a lot of people know about. Well, of course, that only covers leave as an accommodation, right? So you need to stay home for some period of time. You need to be away from work for a doctor's visit. if you needed an accommodation that kept you in the workplace, such as a different schedule or a workspace that was closer to the bathroom or that kind of change, FMLA wouldn't help you. Additionally, you had to have worked for your employer for a full year before the FMLA covered you. So that was sort of the landscape we were living with for many years, and it left many, literally hundreds of thousands of pregnant workers out of getting the temporary changes they needed to stay safe and keep their pregnancies safe. So PWFA was the result of tireless advocacy over a decade of both bringing forward the stories of workers who didn't get what they needed, and then also actually the business community really finally joined forces with us, as well as a lot of folks in the, quote unquote, pro-family community, understanding that everybody can be in favor of healthy pregnancies and keeping people working so that they can keep getting their paychecks while they stay safe.
It's wild in my brain, hearing you talk about some of the like being able to go to get your doctor's appointments so that you can check to make sure you're so far, reaching the milestones that you should be reaching as you're healthy, or even, as you mentioned, something as simple as making sure that you are closer to a bathroom if need be. As we know, when somebody is pregnant, they often have bathroom breaks. Like this is just that's biology. That's how that works. Was it just an issue of people being unaware of what pregnant people needed, what accommodations they needed, or pregnant people were they unable to voice what it was they needed? Sort of what was creating these barriers to pregnant folks being able to have the accommodations they needed?
I mean, it's hard to know if it's hard to get inside the mind of an employer that's going to deny accommodations, but you certainly heard defenses from employers about disruptions to business or that if you had someone who had a more serious need, like a change in a schedule, for instance, employers just saying we can't do that, it's too difficult, we don't do that for anybody else, so why do we do it for you? I think having done this work for a very long time, I can tell you that I think that pregnancy, for all of its prevalence, 85% of working women will have at least one child during their careers. So it's really a fact of life. But at the same time, I don't think our workplaces and the cultural attitudes in our workplace have really come up to speed with the fact that it's a normal condition of employment. And pregnancy and pregnant people are still sort of seen as looking for special treatment or the exception to the rule. I can also tell you, having represented a lot of women who work in male-dominated spaces, like law enforcement officers or firefighters who have needed accommodations, there's most definitely an attitude of, wait a minute, you want to do a man's job? Well, this is what it takes. Sometimes it's dangerous. And if you're asking to temporarily be exempted from those duties while you're pregnant, well, gosh, you shouldn't be here. So I think we chiefly had an attitudinal problem to overcome. I do think, and I know from speaking to our lobbyists who worked on getting PWFA enacted, by the time the federal statute was passed, 30 states, as well as some localities, had some version of a pregnancy accommodation law in place. And guess what? The sky didn't fall. Employers in those jurisdictions were complying with those statutes, and pregnancy is a temporary condition. They were able to do it, and most modifications that people need are very minor. And so you saw the U.S. Chamber of Commerce get on board with the PWFA. And so I think even by the time PWFA was enacted, those kinds of attitudinal shifts were starting to happen. And we can only hope that with this new law, pregnancy and needs of pregnant people will just get even more normalized.
Julian, in speaking with you, I can see your passion for this and I love it. And so I wanted to take a moment, if it's okay to step back and ask you, how did you get involved in this type of advocacy work? Was there sort of, what is Oprah, the aha moment that you had at some point in your life?
Um, I love talking about this because it's rare that you get to see in the course of your career in a relatively short period of time such a sea change. I've been practicing employment law a long time, but it was about, gosh, almost 20 years ago that I had my first client who needed accommodations on the job. She was a baggage handler for a major airline. And as you might imagine, as a baggage handler, she had to lift heavy things all day long. And she sought to be temporarily excused from having to do that and do other things, other parts of her job, and not do that part of it for the duration of her pregnancy. And she was denied. And the employer said, we only make those kinds of changes for people who've been hurt on the job. And you did not get pregnant on the job, and so you do not qualify for that exception. And I saw at that time, I mean, this was in 2005, 2006, that the law was very much on the employer's side. And that seemed crazy to me because the PDA had been around for a long time. And I started developing a practice in that area, and mostly was representing firefighters and police officers. Again, sort of shouting into the void, to be completely honest, and really having a hard time getting traction from reporters, from the Equal Employment Opportunity Commission, from the courts. And it really was only around the time of the Young versus UPS decision, which was in 2015. So that's almost 10 years ago at this point, that the issue kind of started making its way into the broader consciousness. And then, there were many, many more of us doing this kind of work. But it really, I'm grateful to those early clients who told me their stories and trusted me with them, because and then decided to take their employers on, because the law was really not caught up to the reality of the fact that pregnant people are here to stay, and they are doing jobs that can sometimes conflict with the realities of pregnancy. And we've been accommodating people with disabilities since 1990, and we can do it for them too. So I really get my passion from the clients with whom I've gotten to work, and who have trusted me with their struggles, and who were just trying to have families and earn their paychecks like men, or like other people who don't get pregnant.
There's something I'm curious about when we're looking at, I don't know if discrimination is the right word for what pregnant people were facing to not be able to have these accommodations, but I think looking at it, we know right now our nation is facing a crisis of maternal mortality. And then that also then translates often into infant mortality as well. How do you see the PWFA helping address this crisis that we have on our hand? I know just last year, I think there was a report that was issued of just about how the US's maternal care is devastating compared to other first world nations, our allies. So how do you see, is it possible the PWFA can help address the maternal crisis that we're seeing, that we also know disproportionately affects Black and Brown women?
Absolutely. And that was definitely a key component of our advocacy around getting this law enacted. Black and Brown women are disproportionately overrepresented in the low wage, physically demanding jobs that can be really dangerous during pregnancy. So retail workers who stand on their feet all day long, or cashiers who stand on their feet all day long, or healthcare workers, certified nursing assistants who help our loved ones, our seniors in and out of the bath or bed, or nurses who do the same. Or custodial workers, the housekeepers who clean our hotel rooms or clean our office buildings when we all go home at night. These are all really dangerous jobs in terms of exposure to toxins or just physical demands that can conflict with pregnancy, and so endanger the populations that are already at higher risk for poor outcomes for themselves and for their babies. But even for Black and Brown women who are professionals sitting at desks that as we know full well, being in a higher income bracket doesn't protect you from these poor outcomes. And so it's really a critical component in assuring maternal health and babies' health of families. Maybe I could, before we go further, give just a quick thumbnail of what the law actually does as sort of a frame for these further discussions. It's modeled on the Americans with Disabilities Act, and so it requires that employers make, and I'm going to use air quotes because some of these phrases are drawn from the ADA and also are the areas where the EEOC's forthcoming regulations are offering the most kind of amplification. The law requires quote unquote reasonable accommodations for the quote unquote known limitations of a person affected by pregnancy, childbirth, or related medical conditions. That language is drawn from the Pregnancy Discrimination Act, which bars discrimination against people affected by pregnancy, childbirth, or related medical conditions, quote unquote. And those reasonable accommodations have to be made unless they would impose an undue hardship. Again, that's a phrase borrowed from the ADA. So that's what we're talking about here, are reasonable accommodations for somebody who has some sort of limitation. It doesn't have to just be someone who is pregnant. It could be somebody who is recovering from childbirth and has postpartum depression, for instance, or has postnatal visits that they have to attend to. It can also apply, the related medical conditions definition also applies to conditions prior to pregnancy, whether it's infertility treatment or menstruation. We're also arguing that it covers menopause and symptoms related to menopause, which PS Black and brown women suffer disproportionately severe symptoms as well, and it pushes older women out of the workforce. So that's what we're talking about: reasonable accommodations of known limitations related to pregnancy, childbirth, or related medical conditions, unless it would impose an undue hardship. And that's a standard, by the way, the undue hardship that employers have been complying with and understanding what that means since 1990. So, 34 years. Did I do my math right? 34 years.
It's incredible how comprehensive it would be. And something that really stood out to me was when you were talking about even post-pregnancy or postpartum, because, in our research for the Switch Up, we found that a lot of the maternal deaths that were occurring were happening within 1 year postpartum for women. And then when you look at some of the causes of that, postpartum depression is very big. And I know our society still hasn't fully grasped that postpartum depression is a real thing and needs to be addressed. And that's a whole nother conversation about mental health and the way our country handles mental health. But in going along, I think you said this is like 10 years in the making. How did you, or how do you know that this language and the work to have this was passed? What had to happen? I mean, it didn't happen overnight. Clearly, it wasn't one person coming forward and saying, "Here's what I had to deal with." Can you sort of walk through the process of what these last 10 years looked like to be able to get to this point now?
It's really an incredible success story. And as I said, it is so gratifying to see a concrete, enormous problem in the law, of a huge gap in the law, actually get addressed and get that gap closed over a relatively short period of time. It took many different components. As I mentioned before, these gaps in the federal law and the losses that pregnant people were experiencing in court and the denials of accommodation that they were experiencing on the job, which, by the way, meant that they either had to leave their jobs, right, to stay safe, or they had to continue doing their jobs unsafely. Those people were really an enormous reason, and their stories were an enormous resource in this effort, because that's what this is all about, is real people and the impact of a shortcoming in the law. I think that the tide of state and local statutes that started in the aughts, the mid-aughts, and as I said, had swelled to 30, so more than half the states by the time PWFA was enacted. The states stepping in and saying, okay, Congress, you're not going to resolve this issue. We're going to do something about it for the people who live here. So I think that raised consciousness among employers. It sort of changed the conversation culturally. Wait a minute, why is this even a problem? Of course, we should be making it possible for people to continue working safely. And then, as I said, business community seeing, wow, the sky isn't falling. We can do this. And furthermore, it really is complicated if we are a business that does our business nationwide, and we're subject to one set of laws over here in these states, but not over here because we don't have a federal law. So I think that reality and the business community, which is often, often has a cost-based argument to raise against new labor and employment laws. They were able to say, this isn't hurting business, and in fact, it helps business to keep, to lessen turnover, to increase retention and increase loyalty, diminish the amount of time that people are sick because of complications, because they're getting the preventive care they need. So that business case kind of gained momentum as the state and local laws took effect. And then, as I mentioned, there was this really important component of the faith-based community coming in and saying, look, somebody who has to make a choice between their doctor's orders to not do repetitive heavy lifting, not be exposed to these chemicals. Either you're going to make them quit their job, or you're going to possibly be setting up an incentive where someone might want to have an abortion, need to get an abortion to be able to continue working and get that paycheck that their family needs. I absolutely, in my career, have had clients who have considered obtaining abortion care when they didn't want it, because they needed their job so badly, and they couldn't stay on the job. They couldn't get the accommodations they needed to keep working. And so what other choice did they have? So I think a lot of folks who might otherwise be on the other side of some of these more progressive measures was able to form common cause with the more kind of traditional women's rights forces, gender justice forces that like the ACLU, that you might imagine would be in support of this. Ultimately, it was the stories of the people who were being denied the accommodations they needed that I think really got everybody to the table and convinced them that this is something that is not a heavy lift, no pun intended, and is really needed because existing legal protections were just not cutting it.
And I wanted to ask about this, and maybe this is a little bit complicated, but we are, is it 2 years, almost 2 years post Roe, Supreme Court's decision to overturn the federal right to an abortion. When we look now at the PWFA, how does that affect the reasonable care that a pregnant person might need? Obviously there are lots of reasons why somebody might have to obtain abortion, including it's not a viable pregnancy anymore, or it's going to harm the pregnant person. How does the overturning of Roe v. Wade affect what happens now for care such as abortion care? And does the PWFA offer any sort of coverage for that in its wording?
So the PWFA, the statute itself does not, but part of the statute directed the Equal Employment Opportunity Commission, which is the federal agency that enforces our nation's anti-discrimination laws, including PWFA. Congress directed EEOC to put forward regulations that have the force of law. They're incorporated into the statutory language, and those are what we've been waiting for a number of months now to come out. The EEOC published draft regulations back in August of 2023, and the final regulations are expected any day now. And when those draft regulations came out in August, the EEOC made explicit what previous court decisions over the life of the PDA, the Pregnancy Discrimination Act, has made clear, which is that abortion care is encompassed within the definition of related medical conditions, pregnancy, childbirth, and related medical conditions. That has been the case since the PDA was enacted in 1978. If someone experiences discrimination because they seek abortion care, that has been deemed to be a form of discrimination outlawed by the PDA. And likewise, under the Pregnant Workers Fairness Act, if someone requires time off of work to obtain abortion care, that is something that needs to be reasonably accommodated unless it would impose an undue hardship. That protection obviously is critical in the aftermath of Dobbs. It's always been critical. And of course, we should emphasize, and I'm sure you do on your show all the time, that prior to Dobbs, it's not like abortion was readily available for huge swaths of the country. It's always required a lot of time off of work for huge parts of the country to obtain abortion care. But in the aftermath of Dobbs and the more than 30 states in the country that now have some form of either an abortion ban or a serious curtailing of access to abortion, that people are going to have to travel and to obtain needed care. And then let's not even consider the states where there are these medically unnecessary counseling appointments and so forth, so that you need 2 trips to your provider to get needed care. But there are studies out, the Journal of the American Medical Association put out a study recently showing that in Texas, for instance, post-Dobbs, the average travel time needed to obtain abortion care has gone up by 7 hours. That's a full workday, right? And so that means that you are going to need at least a couple days off of work just to get to and from the facility. So that travel time, just like travel time to obtain necessary obstetric care, is going to be covered. That's what the EEOC said in its regulations. We're waiting for the final regs, but we fully anticipate that will be in there because, as I said, abortion has been seen as related to pregnancy since there has been federal protection against pregnancy discrimination.
You said increase of 7 hours, and my brain just fluctuated hearing that, thinking, as you said, that's a whole workday for people, and that is just that's wild. And I know that speaks more to where we are right now in terms of legal reproductive care, being in a post-Roe or the Dobbs world that we are in right now. With all of that in mind, is the ACLU and other advocates expecting any sort of pushback to the PWFA with these new regulations coming out? Or is it going to be sort of one of those things where the regulations come out and that's it? We live with it and we move forward?
Would that it were true, Cheyenne. I mentioned that the draft regulations came out in August, and that was for the purpose of obtaining public comment on the draft regulations. And so now we're waiting for the final regs when the EEOC has taken all of those comments into account and possibly made changes or tweaks or not. And at the time that the draft regulations came out, unquestionably, there were some noisy critics who attacked the coverage of abortion. There also have been noisy critics from the business community, saying, hey, we supported this, but this is going too far in certain respects. You're asking too much of us. Certain pushback on what would be considered a reasonable accommodation or what would be considered, an undue hardship under the regulations. So there is always pushback on a sweeping new statute like this, I think it is fair to say that when, and I say when, not if, abortion is reiterated as being something that that employers need to accommodate, that there will be pushback. I will say something that we at the ACLU and a lot of our coalition partners emphasized in our comments on the regulations is that there are extensive protections, privacy protections for people under the ADA with respect to what they have to tell their employer about why they need an accommodation, and the same should apply here. In fact, the draft regulations were very explicit about when it will be reasonable for an employer to seek any sort of medical certification, and in fact that an employer is not required to do so, nor is it recommended that they do so. They should, allow the worker to self-certify their need for whatever it is, time off, a stool to sit on, a revision in their schedule. That discussion, that interactive process, which is really critical, the give and take about what's needed and what's okay for the business, that process doesn't have to also include, a lot of doctor's notes and certification, chiefly because it's not appropriate for an employer to know the ins and outs of the kind of care you're getting. So the main thing that we've emphasized, and we hope the final regulations make clear, employers are entitled to know that you have a limitation that is related to or caused by pregnancy, childbirth, or a related medical condition. So it falls within the PWFA and triggers its protections. They are not entitled to know the ins and outs of your treatment and needed procedures. So the hope is that this, pitting employers and workers against each other around the issue of abortion will actually prove to be a non-issue, because either employers won't make a fuss at all and will allow people the time off they need, or that they will not impose intrusive medical certification requirements that invade people's privacy.
Looking at all of this, I'm curious your opinion. Again, when you were talking about some of the accommodations that pregnant people need, again, whether that's being closer to the bathroom or saying I have to go to my doctor's appointment, do you think those who aren't pregnant, or those who don't know somebody who's pregnant, haven't experienced that moment yet in their life, are aware that these issues were facing pregnant workers? Because I think about some of the work that we've done already on the maternal health crisis, and even some of our elected officials saying that they hadn't been aware of it until they came to Congress, or until somebody that they knew or cared about brought it forward to them. So I'm curious if, in your experience, you think that the general public who hasn't had that moment of being exposed to somebody or themselves these experiences are even aware that this was something that was happening in the workforce.
Whenever we do place op-eds or do blog posts or do other kinds of forward, public facing work and get feedback from the public about these issues, there were two messages that came through constantly, which is, number one, of course pregnancy is going to sometimes intrude on a job, some jobs more than others. And are you kidding me? This isn't the law already? Those were the two messages that really came through. So I think it actually came as a surprise to most people that this was even an issue, that people were very routinely being denied the usually very minor modifications that they needed to have a safe pregnancy. So I think that was actually the message that we were getting most of the time was, are you kidding me? At least from members of the public. Now, I think legislators are always a different animal, and you need look no further than the demographics of our legislators to and especially in DC to see that there might be some people who are not all that familiar with what pregnancy really is all about. Let me just say, in fact, we unfortunately sometimes see the almost the opposite extreme of thinking that pregnancy is so debilitating that why is anyone at work? Why would you even want to continue being a police officer, for instance, during your pregnancy? How in the world would you think that you could keep doing this? I should say right now we are involved with our Southern California affiliate and private co-counsel in representing female dock workers at the ports of LA and Long Beach. And longshore work, a lot of it is very strenuous and has this very macho, reputation. But, there are several jobs that longshore workers do that are entirely consistent with pregnancy. Physically strenuous work isn't even inconsistent with pregnancy in a lot of situations. It's just certain kinds of physically strenuous work or frequency of certain physically strenuous tasks. So this is all by way of saying that I think we did definitely have some educating to do of lawmakers that some pregnancy symptoms are in fact, super serious and life-threatening and maybe even, that qualify as disabilities. But a lot of them are just kind of routine, annoying or intrusive symptoms. And, and to the extent they are more serious, they're temporary. And, this is something that everybody can live with if we just make it treat it as a normal condition of employment. I'll just say one last thing, which is I'm a huge believer in the power of law to shape culture. I mean, a lot of times culture shapes law, and you mentioned unfortunately sometimes legislators or judges frankly need to have someone in their lives who has experienced a particular issue for their consciousness to be raised and for them to understand that a law is needed. But I think also that shows like yours or other coverage of the PWFA that goes out into the world does an immeasurable public service of letting people know this is a problem that has been around for a long time, if you can believe it, and in 2024. And now here is this new kind of regime. Let's all get on board together and make that make it work. And I think I think that there's huge potential, given how prevalent pregnancy is, for that to really happen.
I'm Cheyenne Daniels, race and politics reporter for The Hill, and from all of us at The Hill, thanks for listening to this episode of The Switch Up. You can watch my full interview with Gillian on YouTube, and be sure to follow The Hill at THEHILL on all social media for future updates, including episode drops and articles. The Switch Up was written by me. Audio production for this episode by Casey Brady.